From a young age, I always knew I wanted to go into medicine. I was that kid that was like, I want to be a doctor when I grow up. So that part was already kind of set for me. And then as I started going through school and then into medical school, I really gravitated towards peds. I love working with kids. It feels like it's not as much of a work and we can play a lot. So that part was also set. Around the same time that I was in medical school, we started, our family experienced epilepsy in a different way through one of our family members. So the coupling of learning about neurology and being interested in it, as well as walking that path with a loved one, kind of sealed the deal.
Chi-Chi approaches her job with character and depth. She's a wonderful physician, not only in terms of her depth and breadth of knowledge, but she's a caring physician. Her patients love her, her colleagues love her.
One of the, I think, beautiful things, but also challenging things about working in pediatrics is that we just don't have one patient. We really try to make sure that the primary patient has what they need, but then also supporting the rest of the family. So education, giving them tools to work with the schools, giving them tools to work with daycares, letting them know that this is a safe place, like bring me all of your concerns and issues, like, yes, seizures are okay, but what about this? What about that? How can we also help make sure that your life is really all together and full?
Officially, I'm her boss. I'm actually her boss's boss. But when she takes care of one of my patients, I'm the person who learns from her. And that's really, it's fun. It's fun seeing people that are junior to you teach me about my patient's illness.
I'm happy that organizations like the Epilepsy Association do exist because they can really step in that gap and provide a lot of that extra education and awareness. So the more education we can get out there to the general public, the more we can empower patients and their families to talk about their epilepsy, to know that they're more than their epilepsy. I think it works for the good of all. When I found out that I was nominated to receive this award, my mind was blown. I was in shock. I couldn't believe it. I know some of the people that have been awarded in the past, and I've been very honored to have trained under them or to work with them. And to be at this point where I'm considered to be among them is, I don't know. It's really, I'm very appreciative of it.
Chi-Chi, you're a gifted physician. You care about your patients, you care about their families, you're a true hero, and you exemplify what we all want in the doctor taking care of us or our children.